So on Monday, we opened the show by telling you about coronavirus. That seemed like a very serious problem and likely to get much worse. At the time when we said that, 12 deaths had been reported in Iran from the virus. Tonight, 4 days later, well, according to the BBC, at least 210 are dead in Iran as of today. Monday night, Italy had 229 cases of coronavirus. Tonight, that figure is quadrupled. It's now 888. 3 days ago, South Korea had just under 900 cases of the virus. Today, they have at least 2,300. Coronavirus has been reported on every continent on the globe, apart from Antarctica, and it's spreading faster than authorities can keep track. The virus is in nearly 60 countries so far. In China, the death toll rises by dozens each day, and those are just the official numbers. So what about America, where we live? So far, the U.S. has confirmed 62 cases of coronavirus. That includes 2 new cases now of unknown origin. That's far lower than many places, but keep in mind, we really have no idea how many Americans have coronavirus. At the beginning of this week, the CDC had tested 426 people for the virus. As of right now, Friday night, the CDC has tested another 33 people. All.
The CDC has only tested 33 people this entire week. What is going on here?
A week, 33, in a country of 327 million. A country that, by the way, effectively has open borders. More open, in fact, than we may realize. Earlier today, CBS New York did a report on 2 American girls who've just returned from a canceled study abroad program in Italy. They're sending all the kids home. The girls said that when they arrived in the U.S. at the airport, and again, they were coming from a place they'd been forced to leave because of coronavirus. But when they got here, they weren't screened at all. They weren't even asked questions about the virus. Why? Because even now, with serious week-old epidemics in Italy, Japan, and South Korea, our government is still only screening flights from China. Does anyone really believe this virus will stay under control? Probably not. People with money on the line have already expressed their view of the subject. The Dow Jones dropped another 357 points today. Over the whole week, it fell 3,500 points. This is the biggest drop since the financial crisis. 3 of the Dow's 5 worst days in history happened this week. Meanwhile, the FDA announced that when
3 of the Dow's 5 worst days in history happened this week because of the coronavirus. And it's spreading all over the world. It doesn't appear to be here in force yet. We're letting people in without testing them. Now, some people will blame President Trump for this when, in fact, it's the CDC. They're responsible for this type of issue. So I think what they're trying to do is they're going to wait and let these people in and not control it. Only test 30 people a week, and all of a sudden it's going to explode in the United States. And then they're going to have something to bitch about President Trump about, or complain about President Trump about. That's my theory. And hopefully someone's warning Trump that this is happening, and he will get on the ball and get the CDC moving.
Now facing a drug shortage thanks to coronavirus, though weirdly they didn't name the drug, and that is bizarre. We do know another thing we're short of, though: face masks.
After already restricting travel from China, Hallie Jackson has more on that.
President Trump tonight weighing new travel restrictions, possibly for places like Italy.
We're looking at that right now, and we're looking at
places like Italy where we just let people in and the CDC didn't even test them. Those college students. Wonderful.
a couple of countries, a few countries that have a little bit disproportionately high number. And we're going to make that decision very soon.
It's just one of the steps the White House is considering, along with using a Cold War-era law to speed up production of supplies like masks and gloves and preparing new guidance.
So the White House is doing this. That's like the CEO of a company having to respond to, a coffee spill down in the cafeteria. It doesn't make any sense at all. Wouldn't the CDC be prepared to shouldn't the CDC be the agency that already has plans in place to mitigate a problem such as this? I mean, don't they have disaster plans that cover protocols for when a global virus hits like this? I mean, why would the White House have to suddenly do this? Isn't that what the CDC is for? Apparently not.
To accelerate what the health secretary calls the #1 priority, getting test kits to those who need them.
We want to get it out there to more places.
Vice President Pence in Florida today insists now is the time for political unity. But in Washington, a back and forth over who's really playing politics in this crisis.
The Trump administration has shown
Here we
towering and dangerous incompetence when it comes to the coronavirus.
He shouldn't be.
Towering and dangerous incompetence when it comes to the coronavirus. So the White House, these politicians are supposed to be the world experts on mitigating a virus, a viral global pandemic of a virus. That's what the CDC is for. They should have protocols in place. They should have procedures in place. They should have practiced this drill dozens of times by now. They should have gone through this. I'm going to research it. I bet you they have. So why are they sitting on their hands and doing nothing? Because they're trying to set up President Trump for, they'd rather let people die of the coronavirus just so they can badmouth Trump than prevent this thing from getting a hold in the United States. It's unbelievable.
Making statements like that because it's so bad for the country. And Nancy Pelosi, I mean, she should go back to her district and clean it up.
And late today,
Some of the Democrats are doing it the way it should be, but some of them are trying to gain political favor by saying a lot of untruths.
the president's acting chief of staff blasting the media, which for weeks has covered a deadly virus that's now infected more than 80,000 people in more than 50 countries.
The reason you're saying so much attention to it today is that they think this is going to be what brings down the president.
Yeah, yep.
Also tonight, the president nominated Congressman John Ratcliffe to serve as Director of National Intelligence 6 months after Ratcliffe's name was withdrawn for the same job. Critics question.
Okay, so now we're going to talk about the World Health Organization. So I really don't know what kind of jurisdiction the World Health Organization has inside the United States. I'll do some research and figure it out. But so now they're going to talk about the World Health Organization's response to it. So here is yet another organization filled with people who are earning big salaries, who should have literally practiced. They should have done drills for this dozens of times by now. The World Health Organization should have coordinated with the CDC and whatever other agency inside the United States and in other countries, to manage a situation like this. You'd think that would be something that we were completely prepared for. I mean, look at this flu outbreak, Spanish flu in 1917. I mean, if something that deadly hit now, like 1 billion people would die. But no, it's President Trump's fault and his responsibility, apparently. I don't know, let's see what they have to say.
Health organizations sounded a new alarm about the coronavirus today as countries from Europe to Asia imposed new restrictions. More on that now from NBC's Kelly Kobiea in Tokyo.
Tonight, 12 million students in Japan are out of classes. Schools across the country closed for a month to stop the spread of coronavirus. Cases here now top 200 with 2 more deaths, including a 6th passenger from the Diamond Princess cruise ship. Tonight, the World Health Organization raising the risk level globally to very high.
Health systems around the world are not ready.
Raise the threat level to very high, and we're letting people in to our country. We should have let them in, those students who had been to Italy. We should have let them in. But we let them in and let them go right back to their communities. Seriously? I mean, that should be against the law right there. I mean, this should be unbelievable.
and need to be better prepared to absorb the impact.
Disneyland closed its gates for the first time since the devastating earthquake and tsunami in 2011. This visitor says, "I don't know who has the virus. I can't see it. It's best Disneyland closes." Tokyo putting the finishing touches on Olympic venues, saying there is no plan B. The game's now 5 months.
Okay, so that story took a little turn. Hang on, we'll go back to Tucker in a second. Okay, so more on mainstream media here. So they're going to talk about a case of coronavirus in Mexico. Check this out.
Nigeria, and 2 cases in Mexico, both men who'd been to Italy.
2 cases in Mexico, both men who had been to Italy. And we let a bunch of students who were forced to leave Italy because of coronavirus, we let them back to our country, back into their communities, without any testing or quarantine. And it's going to be Trump's fault. You'll see. It'll be Trump's fault, not the CDC.
Markets are in a tailspin. Stocks plummeting roughly 4% in China, Japan, and Europe.
All right. Hang on. Back to Tucker. Okay. I searched, does the CDC ever do any drills for global pandemics? And I came up with this. The National Strategy for Pandemic Influenza Implementation Plan. 223 pages. Let's see what we got. Oh, it's a whole book. Implementation Plan. National Strategy for Pandemic Influenza. Homeland Security Council from 2006. National Strategy for Pandemic Influenza Implementation Plan. Homeland Security Council. The White House, my fellow Americans, on November 1st, 2005, I announced the National Strategy for Pandemic Influenza, a comprehensive approach to addressing the threat of pandemic influenza. Our strategy outlines how we are preparing for and how we will detect and respond to a potential pandemic. Since then, our nation has taken a series of historic steps to address the pandemic threat. In December, the Congress appropriated $3.8 billion. The International Partnership for Avian and Pandemic Influenza, which we launched at the United Nations in September 2005, has encouraged openness and coordinated action by the international community. Here at home, we have made major investments in vaccine and antiviral development, research into the influenza virus, surveillance for disease in animals and humans, and the local, state, and federal infrastructure necessary to respond to a pandemic. By making these critical investments of $3.8 billion, the federal government has begun strengthening our ability to safeguard the American people in the event of a devastating global pandemic and helping to prepare the nation's public health and medical infrastructure. Building upon these efforts, the implementation plan for National Strategy for Pandemic Influenza ensures that our efforts and resources will be brought to bear in a coordinated manner against this threat. The plan describes more than 300 critical actions, many of which have already been initiated to address the threat of pandemic influenza. Our efforts require the participation of and coordination by all levels of government and segments of society. State and local governments must be prepared, and my administration will work with them to provide necessary guidance in order to best protect their citizens. No less important will be the actions of individual citizens whose participation is necessary to the success of these efforts. Our nation will face this global threat united in purpose and united in action in order to best protect our families, our communities, our nation, and our world from the threat of pandemic influenza. George Bush, May 2006. Table of contents. I can't read it with this camera in front of me here. The pandemic threat, the U.S. government planning for a pandemic, the federal government response to a pandemic, international efforts, transportation and borders, protecting human health, protecting animal health, law enforcement, public safety. Okay, so we've got the executive summary. We've got Chapter 1, the pandemic threat. Chapter 2, U.S. government planning for a pandemic. National strategy implementation. So, this thing is 233 pages of preparation for pandemic that goes back to 2006. And, it can be found on the CDC website. That's where I found it. Influenza viruses have threatened the health of animal and human populations for centuries. Their diversity and propensity for mutation have thwarted our efforts to develop both a universal vaccine and highly effective antiviral drugs. A pandemic occurs when a novel strain of influenza virus emerges that has the ability to infect and be passed between humans. Because humans have little immunity to the new virus, a worldwide epidemic or pandemic can ensue. Three human influenza pandemics occurred in the 20th century, each resulting in illness in approximately 30% of the world population and death in 0.2% to 2% of those infected. Interesting, that's about the 2.4% is what I heard for coronavirus, and they said that might be high. So interesting that we're right in line with that. Using this historical information and current models of disease transmission, it is projected that a modern pandemic could lead to the deaths of 200,000 to 2 million people in the United States alone. And this is from 2006. And here we are sitting on our hands, letting people come in from Italy and letting them go right back to their communities. Somebody should be arrested for that. That should have been a criminal act. Letting those people go. That should be considered a criminal act, I believe. My cat's going crazy back there. Animal populations serve as a reservoir for new influenza viruses. The economic and social disruption of an influenza pandemic could be significant. Yes, absenteeism across multiple sectors. Yeah, we saw that with the Dow, with the markets this week. U.S. government planning for a pandemic. The president announced the National Strategy for Pandemic Influenza on November 1st, 2005. The strategy provides a high-level overview of the approach that the federal government will take to prepare for and respond to a pandemic, and articles expectations of non-federal entities to prepare themselves and their communities. This strategy contains 3 pillars. 1, preparedness and communication. 2, surveillance and detection. And 3, response and containment. They've got it. We've got the plan right here. And we're just not, if you watch the news, it seems like there's no plan in place yet. It seems like we're kind of figuring this out as we go. Why aren't we just implementing this plan? Let me scroll through here and figure out what that containment thing is, and I'll be right back. Okay. It is important that the federal government have a defined mechanism for coordination of its response. The National Response Plan is the primary mechanism for coordination of the federal government's response to incidents of national significance, and it will guide the federal pandemic response. It defines federal departmental responsibilities for sector-specific responses and provides structure and mechanism for effective coordination among federal, state, and tribal authorities, the private sector, and non-governmental organizations, NGOs, pursuant to the NRP and Homeland Security Presidential Directive 5. The security is responsible for... All right. The pandemic will present unique challenges to the coordination of the federal response. First and foremost, okay, hang on. Okay, so here they talk about computer models. Actions to implement the National Strategy for Pandemic Influenza. Modeling to inform transportation and border decisions. Models are powerful tools that can be used to inform policy decisions by highlighting the impacts of various interventions on the spread of disease. Models can predict the social and economic ramifications of specific transportation and movement interventions, and can inform the assessment of their operational feasibility of these interventions. We will expand our infectious disease modeling. Modeling to inform transportation and border decisions. screening mechanisms and travel restrictions, quarantine and isolation of travelers. The current Centers for Disease Control and Prevention recommend for managing air passengers who may be infected with an influenza virus with pandemic potential include isolation of ill persons, quarantine of all non-ill travelers and crew, and targeted treatment and prophylaxis with antiviral medications. The federal government will develop criteria and protocols for isolation and quarantine of travelers early in pandemic, prior to a significant spread of the virus in the United States. The federal government will develop criteria and protocols for isolation and quarantine of travelers early in a pandemic, prior to significant spread of the virus in the United States. I repeated that just because we're there. We are there. And I don't understand this 223-page document. We will develop criteria and protocols. Why didn't they develop criteria and protocols? It doesn't make any sense. Trade and movement of cargo. All right, I'll be back. Okay, so we're down to actions to implement the national strategy for pandemic influenza, achieving national goals for production and stockpiling of vaccine and antiviral medications. The federal government has established two primary vaccine goals. One, establishment and maintenance of stockpiles of pre-pandemic vaccine adequate to immunize 20 million persons against influenza strains that present a pandemic threat. Two, expansion of domestic influenza vaccine manufacturing. I can't read it through my phone. Surge capacity for the production for pandemic vaccines for the entire domestic population within 6 months of a pandemic declaration. Okay, so there needs to be a pandemic declaration. 6 months of a pandemic declaration. I didn't read anything above this that detailed the criteria necessary to make the call or the declaration of a pandemic. So that's possibly vague. All right, hang on. Okay, so we talk about prioritizing and distributing limited supplies of vaccine and antiviral medications. Deploying, it's hard to read in video, it's deploying limited federal assets and resources to support local medical surge. Establishing real-time clinical surveillance, modeling to inform decision-making and public health interventions, protecting animal health. All right, I'll be back. Okay, so here we've got Chapter 9, Institutions. Protecting personnel and ensuring continuity of operations. It's kind of like continuity of government. And, if a bunch of first responders and police get sick, to ensure continuity of police force and fire and for things like that and government, blah, blah, blah. I'll be right back. Okay, Chapter 2, U.S. Government Planning for a Pandemic. Now, again, this is from 14 years ago. And above here, they talked about computer modeling, which is, great stuff. You need data for that. And we should have had data from SARS and the avian flu and Ebola and stuff like that. A computer model is only as good as the data it's using for its forecasting. So the pandemic threat. Influenza viruses have threatened the health of animal and human populations for centuries. The National Strategy for Pandemic Influenza. Pandemics represent unique threat to health and society, productive system, blah, blah, blah. The strategy contains 3 pillars. 1, preparedness and communication, surveillance and detection. We already went through this. Implementation of the national strategy framework for... Sorry, this is... I'm not a professional YouTube video maker or anything, so I'm just a hacker who's a little... I'm not worried about this. I just... I am. This might be a big deal. And I don't want family members and friends and loved ones dying of this. So I'm trying to do something. Making YouTube videos doesn't seem like much, but what else can I do, you know? I'm trying. All right, hang on. The World Health Organization represents the linchpin of international preparedness and response activities. It is bolstered. This linchpin is now bolstered by other multilateral and bilateral organizations. Blah. But during a pandemic, we will rely upon it to be a highly visible and credible coordinator of the international response. Given the critical role that it plays, its linchpin role, it is essential that the international community support its efforts with resources and personnel and expand plans to provide emergency increases in capacity when the emergence of a pandemic virus is suspected or confirmed. They still really haven't talked about what criteria must be met to be considered a pandemic. You think that would be pretty important? As we take action to support efforts of the World Health Organization, we must draw attention to the need to expand and enhance coordination of international animal health efforts, given the near certainty that the next pandemic will emerge from an animal reservoir. An animal reservoir. Interesting choice of words. Okay, right back. Show me the money. National strategy for pandemic influenza was announced, blah, blah, blah. They keep writing the same stuff over and over. This is probably like 100 pages of stuff, but they just kind of retweeting it in here. No, they're rewriting it in different sections. As emergency budget request of $7.1 billion to support activities over several years was submitted to Congress to support the objectives of the strategy. Let me reread that. An emergency budget request of $7.1 billion to support activities over several years was submitted to Congress to support the objectives of the strategy. An initial appropriation in fiscal year 06 of $3.8 billion has been made to support the budget requirements of the first year of the initiative. $3.8 billion for the first year of the initiative. While much of the funding is directed toward domestic preparedness and the establishment of countermeasure stockpile and production capacity, over $400 million is directed to bilateral and multilateral international efforts. What does that even mean? Bilateral and multilateral. What does that even mean? What are bilateral and multilateral international efforts? I don't even know what that means. And built upon the $25 million appropriation of funds in the Emergency Tsunami Appropriation Act, supplemental of 2005. Key programs that will be supported by the funds appropriated to date. Expansion of the domestic vaccine capacity. So this is $3.8 billion. And that's just in the first year from 06. They're looking for they look for 7.1 billion. I'll have to search and see if we actually ponied up the 7.1 billion. It looks like we did the 3.8. Expansion of domestic vaccine production capacity. Okay, so for $3.8 billion back in 2006, this better be in place by now. Expansion of stockpiles, expansion of surveillance, because it's all the same stuff, just written over and over. This is crazy. Hang on, I'll be right back. Okay, I'm back pretty quick. Over $6 billion has been invested in state and local public health and medical preparedness since 2002 for activities that directly support pandemic preparedness. Over $6 billion has been invested in state and local public health and medical preparedness since 2002 for activities that directly support pandemic preparedness. And this is 2006. So $6 billion, this coronavirus is happening, and it's almost like no one knows what's going on. You know, it's just, with $6 billion spent, there should be people who we've never seen before interviewed on the news saying, this is what's happening. This is the level of this pandemic as we see it on our scale. this is our plan, and this is the status of implementing the plan. But no, it's like this finger pointing and Chuck Schumer saying bad things about Trump. What a joke. Oh my God. Here we go. Real-time surveillance. Department of... This is the same stuff over and over. Cabinet level tabletop exercise of the federal government. Cabinet level tabletop exercise. What the hell is that? Of the federal government response to a pandemic was held in December 2005 to identify and address gaps in capabilities and coordination. The exercise was first... See, this is what I was asking for before. If we've done drills. So we did a drill. It was called a cabinet level tabletop exercise. So it wasn't a drill. It was, you know, something that they sat around in a meeting and talked about. A tabletop exercise. It's an interesting use of words for a meeting. Federal response to any event, natural or deliberate, and highlighted key policy issues that are currently being addressed and resolved. The exercise will lay the foundation for ongoing assessments of federal preparedness for a pandemic. DHHS guidance for state, local, and tribal preparedness was released in 2005. It provides comprehensive guidance for states, communities. It's the same stuff written over and over here. Yeah, it's government. Okay, I'll be right back. Here's a good one. A HHS National Meeting of States was held in Washington, D.C. in December 2005 to provide guidance on the development of state and local pandemic preparedness and response plans. A series of more than 60 local summits on pandemic preparedness encompassing all 50 states will be completed in the first half of 2006. So Chuck Schumer is sitting there complaining about Donald Trump when, in fact, New York State should have state and local. We should have pandemic preparedness response plans. Pandemic preparedness response plans and response plans. New York State should have one of these because we did it in 2006 with the $3.8 billion we got, which was part of $6 billion that they got. All right, I'll be right back. Okay, so, when you do a model, you need to have data for it to run through, but you also have a set of assumptions. So here we go. Pandemics are unpredictable. While history offers useful benchmarks, there's no way to know characteristics of a pandemic virus before it emerges. Nevertheless, we must make assumptions to facilitate planning efforts. Federal planning efforts assume the following. Susceptibility to the pandemic influenza virus will be universal. Oh my God, it's going to cover Martians and the little gray guys? Wow, that's awesome. Efficient and sustained, because it's universal. It covers the whole universe. Efficient and sustained person-to-person transmission signals and imminent... Okay, efficient and sustained person-to-person transmission, that signals an imminent pandemic. So right here, I said, what is the threshold, or what is the, what status will tell us, okay, this is a pandemic. Well, here it is. Efficient and sustained person-to-person transmission. That signals an imminent pandemic. Boom. The clinical disease attack rate will be 30% in the overpopulation during the pandemic. Illness rates will be the highest among school-age children and decline with age. It's probably because school-age children have more contact with each other. Working adults, an average of 20% will become ill during the community outbreak. Some persons will become infected but not develop clinically significant symptoms. Asymptomatic or minimally symptomatic individuals can transmit infection and develop immunity to subsequent infection. While the number of patients seeking medical care cannot be predicted with certainty, in previous pandemics, about half of those who became ill sought care. With the availability of effective antiviral medications for treatment, this proportion may be higher in the next pandemic. So more than 50% of patients will be seeking care. Rates of serious illness, hospitalization, and deaths will depend on the virulence of the pandemic virus and differ by an order of magnitude between more and less severe scenarios. Risk groups for severe and fatal infection cannot be predicted with certainty, but are likely to include infants, the elderly, pregnant women, and persons with chronic or immunosuppressive medical conditions. Rates of absenteeism will depend on the severity of the pandemic. In a severe pandemic, absenteeism attributable to the illness, the need to care for ill family members, and fear of infection may reach 40% during the peak weeks of the community outbreak, with lower rates of absenteeism during the weeks before and after the peak. Certain public health measures, choosing schools, quarantining household contacts of infected individuals, snow days, are likely to increase rates of absenteeism. Typical incubation period for influenza is approximately 2 days. Persons who become ill may shed virus. Persons who become ill may shed virus and can transmit infection for 1/2 to 1 day before the onset of illness. Onset of symptoms, probably. Viral shedding of the risk of transmission will be greatest during the first 2 days of illness. Children will play a major role in the transmission of infection as their illness rates are likely to be higher. They shed more virus over a longer period of time, and they control their secretions less well. On average, infected persons will transmit infection to approximately 2 other people. Interesting. Epidemics will last 6 to 8 weeks in affected communities. Epidemics will last 6 to 8 weeks, damn it. Multiple waves, periods during which community outbreaks occur across the country of illness, are likely to occur, with each wave lasting 2 to 3 months. Historically, the largest waves have occurred in the fall and winter, but the seasonality of a pandemic cannot be predicted with certainty. Federal government response to command. I'll be right back. All right, this is already way too long, this video, so I bet not a single person is going to listen to it. But here we go. Chapter 3: Federal government response to pandemic. The basic deal is this. It looks like $6 billion was spent between 2002 and 2006, with $3.8 billion spent just in 2006 to work on what we're dealing with here. And, it's like everyone's saying, oh, I don't know. Like, no, it seems to me like nobody is aware that this plan exists. It doesn't make any sense to me. What's going on? If somebody knows, please help. Thank you. And if anybody listened to this whole video, you can put in the comments below, the flu sucks. Write the flu sucks in the comments and I'll know you listened to the whole thing. Okay, bye.